Thyroxine, total. Requiring elution, e.g., neonatal. This test may be ordered as a T4. The specimen is serum. Methods may include radioimmunoassay, RIA, enzyme-linked immunosorbent assay, ELISA, fluorescence polarization immunoassay, FPIA, and chemiluminescence assay, CIA. Thyroxine, free. This test may be ordered as a FT4, free T4, FTI or FT4 index. The specimen is serum, requiring special handling. Methods may include radioimmunoassay and equilibrium dialysis for reference method. Thyroxine binding globulin, TBG. The specimen is serum. Methods may include chemiluminescent immunoassay, equilibrium dialysis, ultrafiltration, and solid phase enzyme immunoassay, EIA, technology. Thyroid stimulating hormone, TSH. The specimen is serum, requiring special handling. Heel stick or umbilical cord sample is drawn from newborns and may be collected on a special paper. Methods may include radioimmunoassay, RIA, sandwich immunoradiometric assay, IRMA, fluorometric enzyme immunoassay with use of monoclonal antibodies, or microparticle enzyme immunoassay on IMX, MEIA. Thyroid stimulating immune globulins, TSI. This test may also be ordered as TSI. Methods may include vitro bioassay and radioimmunoassay. The test may be useful in diagnosis of Graves' disease, hyperthyroidism. Tocopherol alpha, vitamin E. This test may also be known as tocopherol. The specimen is serum or plasma, requiring special handling. Methods may include high-performance liquid chromatography, HPLC, fluorometry after solvent extraction, and colorimetry. Transcortin, cortisol binding globulin. The specimen is serum. Method may include chemiluminescent. Transferase, aspartate amino, AST, SGOT. This test is usually referred to as aspartate aminotransferase, AST, or as serum glutamic oxaloacetic transaminase, SGOT. Blood specimen is serum or plasma. Method is spectrophotometry, kinetic assay, and enzymatic. Transferase, alanine amino, ALT, SGPT. This test is usually referred to as alanine aminotransferase, ALT, or as serum glutamic pyruvic transaminase, SGPT. Blood specimen is serum or plasma. Method is spectrophotometry or enzymatic. Transferrin. An alternative name for this test is sidrafilin. The specimen is serum. Methods of testing vary to include immunologic or turbidimetric assay. Triglycerides. This test may be requested as TRIG. Blood specimen is serum or plasma. Method is enzymatic or colorimetry. Thyroid hormone, T3 or T4, uptake or thyroid hormone binding ratio, THBR. This test may be requested as T3 uptake and T4 uptake or THBR. The specimen is serum. Method is chemiluminescent immunoassay. Thyroid hormone, T3 or T4, uptake or thyroid hormone binding ratio, THBR. This test may be requested as T3 uptake and T4 uptake or THBR. The specimen is serum. Method is chemiluminescent immunoassay. Troponin, quantitative. Troponin, qualitative. This test may also be known as troponin regulatory complex. The specimen is serum. Methods may include radioimmunoassay, enzyme-linked immunosorbent assay, and immunoenzymatic assay. Trypsin, duodenal fluid. This test may also be referred to as duodenal trypsinogen. Trypsin in duodenal aspartate has been measured by both radioimmunoassay and enzymatic methods. Trypsin feces, qualitative. Quantitative, 24-hour collection. These tests may be called fecal tryptic activity or immunoreactive trypsin. The specimen is fresh random stool sample. Methods may be kinetic and potentiometric, and X-ray film method. Thyroxine. This test may also be known by the abbreviation TYR. Thyroxine has been measured by chromatographic techniques such as HPLC or gas chromatography. Specimen types vary. Urea nitrogen, quantitative. Semi-quantitative, e.g., reagent strip test. Urea nitrogen, clearance. This test may be requested as blood urea nitrogen, BUN. Blood specimen is serum or plasma. Method is colorimetry, enzymatic, or rate conductivity. This test measures, quantitates, the amount of urea in the blood. In 84,525, method is reagent strip. Uric acid, blood. Uric acid, other source. This test may be requested as urate. Blood specimen is serum or plasma. Method is enzymatic or high-performance liquid chromatography, HPLC, uricase, and phosphotungstate. Urobilinogen, feces, quantitative. This also is known as the urobilinogen 48-hour feces test. The specimen is by random stool sample. Method is colorimetry. Urobilinogen, urine, qualitative. Quantitative, timed specimen. Semi-quantitative. The specimen may be performed over a 2-hour period. Methods may include arylex aldehyde reagent, Watson's method, and urobilistics. Vanillomandelic acid, VMA, urine. This test is also called 3-methoxy-4-hydroxymandelic acid test, and also as VMA. Urine collection is over a 24-hour period and requires special handling. Methods may include colorimetry, spectrophotometry, gas chromatography, and high-performance liquid chromatography, HPLC. Vasopressin, antidiuretic hormone, ADH. This test is also known as arginine vasopressin hormone and antidiuretic hormone, ADH. The specimen is plasma. Method is radioimmunoassay. Vasopressin, antidiuretic hormone, ADH. This test is also known as arginine vasopressin hormone and antidiuretic hormone, ADH. The specimen is plasma. Method is radioimmunoassay. Vitamin A. This vitamin is also known as retinol. The specimen is serum, and requires special handling. Methods are electrochemical, high-performance liquid chromatography, HPLC, and fluorescence or UV/Vis spectroscopy. Vitamin, not otherwise specified. Methods are dependent on the specific vitamin level being analyzed and on the type of specimen, but include microbiological assay, urine biodin levels, high-performance liquid chromatography, HPLC, urine niacin levels, solid phase, cellulose, binding assay, plasma biodin levels, chemiluminescence, serum biodin levels. Vitamin K. The specimen is serum which requires special handling. Method is high-performance liquid chromatography. Volatiles, e.g., acetic anhydride, diethyl ether. Test specimens may include whole blood, serum, plasma, urine, or gastric samples, collected by gastric lavage. Method may be gas liquid chromatography, GLC. This test is performed to determine systemic alcohol levels and possibly as surveillance for drug abuse and to evaluate methanol and isopropanol toxicity due to ingestion, inhalation, or contact. Xylose absorption test, blood and/or urine. This test may also be ordered as a xylose tolerance test. Samples and sampling collection times are physician specified based on patient age and other parameters. Zinc. This test is also known as serum ZN. The specimen is serum or whole blood or a 24-hour urine sample. Methods may include atomic absorption spectrometry, AAS. C-peptide. The specimen is post-fasting serum or urine is over a 24-hour period. Methods may include radioimmunoassay, RIA. Gonadotropin, chorionic, HCG, quantitative. Qualitative. Free beta chain. This test may be ordered as HCG or as a serum pregnancy test. The specimen is serum. Method may be radioimmunoassay, RIA, two-site immunoradiometric assay, IRMA, two-site enzyme-linked immunosorbent assay, ELISA, and radioreceptor assay, RRA. In 84703, this test is also known as a beta subunit human chorionic gonadotropin. The specimen is serum or random urine sample. In 84704, this test is quantitative and identifies the free beta chain of human chorionic gonadotropin using an enzyme immunoassay methodology. Ovulation tests, by visual color comparison methods for human luteinizing hormone. The specimen is urine. Method is rapid chromatographic immunoassay.